So, as we have done many times before, but always a good thing to redo, today we are going to go over our coronavirus tips and tricks, how to stay healthy in this, frankly, often scary situation. But today, instead of having to listen to me do it once again, Jane is gonna take over. Jane, if you want to hit that unmute on yourself, you should have got an alert just now.
There we go. Yay, I did it.
All right, and I will offer annoying asides throughout because that's what I do. But Jane, the floor is yours.
All right. Today what I'm going to talk about is how to protect yourself from the coronavirus. As you know, when we first started off, people were doing social distancing. They were wearing masks to protect themselves. These are the masks I'm talking about. There's different colors that you can get. They're also using hand sanitizer to sanitize their hands and washing their hands constantly. So all of a sudden, we were in a peak. But all of a sudden, after that, people stopped doing what they needed to do to keep themselves and others safe, which was they stopped social distancing. A lot of them weren't wearing masks, and a lot of them, like many places, went like restaurants, the stores, like Kroger's, grocery stores, the mall. They stopped doing that. And because of that, unfortunately, when we were at a peak and it was low, now it's starting to get high again. And plus the other reason was that they found out by doing more testing, more people had the virus. So what we need to do to keep ourselves safe, as I mentioned before, and they've also now made it a law in certain states that we have to wear masks to protect ourselves and others. And if you don't wear a mask, a lot of places will not serve you as a result of that. So it is very important that we wear our masks.
Jane, how should we wear our masks? What's the proper way to do it?
This is the proper way to wear your mask.
So
and make sure your nose is covered.
That's right. Make sure your nose is covered, just like me and Jane. Perfect.
And also, I have two different kinds of hand sanitizers that you can use. You can get these at Walmart. You can get them at Kroger's. You can get them at Dave's, which is where I got a lot of these. Also, another thing you want to do that you can get at Walmart is this special kit. It is only $5. It contains 8 antiseptic hand wipes, 1 pair of gloves, which I'll show you the gloves.
Allow me to point out that other vendors besides Walmart are available.
Right, and these are the gloves that you want to wear. I'm going to show you how to put the gloves on. You put them on like this. Make sure you have them on.
Put your hand up a little further. You're just out of sight.
How's that?
I can see it on, but when you're pulling it on, pull it on in front of your face because you're a little too low.
Okay, so
kind of bad.
Like right here?
Yeah, that'll be fine. Okay, you'll notice one of the things that Jane is doing or not doing that you'll see on TV. See on TV is people pick up a glove and then blow into it. Jane is not doing that, and Jane is correct. TV is wrong. Do not blow into your gloves. They are good and smooth. They often have nice powder in them, so you can go right into them. You don't.
But if you do blow into your glove, you can make a turkey out of it. Just
don't wear it afterward.
Don't wear it after.
The other thing you want to be careful is some people are allergic to latex. So there are gloves that are latex free, There are also gloves that are powder free. So you want to be careful because some people do have allergies, and that if they wear latex, they can become very ill and very sick.
That's a great tip, Jane.
Okay, so the next thing I have is, this is another, these are the hand sanitizer wipes that you can get at various retail stores. You can also get, this is, I believe.
Jane, what would we use those wipes for?
These wipes are used, you can use them to wash your hand, clean your hands, keep your hands sanitary. You can also use them for services as well. Another thing,
Your cell phone, you can clean your cell phone off,
Mhm.
and like your
iPad.
yeah, your iPad, anything that you're touching, your car.
Particularly stuff that other people are touching when you're out, like a shopping cart, although they usually do that, but you might want to do it yourself.
Yep.
Right, and then there's this head protector that you can use for the buses or your car. You put it over your car seat, and it also will protect you.
Do you want to change that out, or do you keep that one on forever?
You want to make sure you change this out.
Cool.
Just like your gloves. And another thing I want to mention about these masks, you can wash them and you can dry them. So you can reuse them. Whereas you have the mask, this particular mask, it's the oh, we lost them.
Oh.
Whoops. Okay. This particular mask is disposable, so you want to throw it out. You cannot reuse it because, again, you're losing a lot of your protection. So these are basically, Mary has recommended these type of masks here.
Can I interrupt you for 1 second
Sure.
to ask you about how a trick to wearing your mask with your glasses? Because I see that you're doing that, and some people say they can't wear a mask because it fogs up the glasses. What do you do?
Well, I use this here, which I have for my glasses. I use these to clean my glasses with. They're like the wipes, and they help keep them clean.
Another thing that I saw Jane doing is she had her mask properly on her nose, and then she had her glasses kind of on the bridge of her nose, so that way the steam or the fog wasn't going up, it was kind of stopping there.
You can use your glasses to help pinch this.
Yeah, like
You
so.
can. And then they also mentioned on TV that, which a lot of people, we had a discussion in my home, Tanette and I, like, they also said, like, if you have any kind of behaviors or any medical condition, talking about who's exempt from wearing masks, or, the first responders, but like we were saying, a lot of people would say, oh, I have a behavior problem, or I have a medical, and they really don't. And they could make excuses why they shouldn't wear the mask. So it is very important that you do wear the mask, not only for your safety, for the safety of others. Because say, for instance, I would talk. If I have my mask on, I keep those fluids from going on another individual and infecting another individual. Or if I sneeze, and again, you are protecting yourself and you are protecting others.
I would just say that if you can make an excuse not to wear a mask, you need to be wearing a mask.
Right.
You have an issue that you don't have to wear a mask.
Right.
Also, Jane, you were talking about the paper mask that we need to throw away, and these cloth masks, which a lot of people make at home. My mommy made me this one. So if you have a homemade mask, one of the things you need to do is make sure that it's thick enough that it will keep everything, all of your fluids next to your mouth. One of the ways to check that is with a candle or a lighter. So if you pull this up, you should not be able to blow it out.
Right. Other masks they have also that you may see on TV, they have the ones, of course, they're a little more expensive. They're like 19, is they have another mask that they advertise that you can get. It has 4 layers of protection, which you're able to breathe. You can wear outside, you can wear inside, they're very comfortable. However, some of those masks can be sometimes expensive. Like if you can get them online or you can get them through the TV, sometimes it can be very expensive. The other thing they were talking about that you could also get if it fits your budget is a cooling mask that not only cools your neck, but it also cools your face. And they also have the cooling hats that you can wear to keep you cool. As you know, it's hot outside. A lot of people go outside, a lot of people doing things outside. It'll help keep you from losing a lot of your electrolytes and extremely sweating. And it can also, keep you cool. So you don't get heat exhaustion or you get overheated.
I don't know about the cooling mask part. I would need to do more research, but
Right.
I would be careful about those. I'm suspicious about how well those might help. Like a cooling collar or a hat with a mask, that seems perfectly reasonable to me. But filling that mask with extra fluid,
Yeah.
I'm not sure that's the best idea, but I don't know, and I would need to research that.
Right. But maybe not wearing the mask, like maybe wearing, you could wear maybe one of these masks and use a cooling hat, different style hats.
That would
And
certainly be a
that
perfectly
would
good idea.
Cooling through your head too, to protect your head as well.
Absolutely.
The other thing that they mentioned on the news is hopefully it won't happen, we won't get it, but now they're talking about the swine flu that is in China. So they're kind of keeping an eye on that to make sure it doesn't come here to the United States. And I guess it can be even, they say it's even worse than the coronavirus. So hopefully we don't have to worry about that as well.
Well, like I say, we are definitely going to come up into flu season, and the coronavirus increase has not slowed down, really.
True.
So what's going to happen as we get into the fall and winter months when flu season starts on top of this? Well, the good thing is, if you are protecting yourself and others very well with the mask, social distancing, washing your hands, everything we do for coronavirus, you're going to be fine for the flu.
Oh, and also, they have mentioned that, as you know, they're looking into different vaccines. They talked about today about hormone therapy, looking at it as finding another way to treat the coronavirus. So they are trying different things to see what will be good for our immune system and also help fight this virus that unfortunately has killed a lot of people and made a lot of people sick. So hopefully they'll be able to, hopefully we can keep our fingers crossed and they do have a vaccine that will help a lot of people.
Yeah.
Jose, do you have a question?
Yes, Jose. I don't know, can you hear me?
No, we can't hear you.
Okay.
Yeah, he's dead, so how do I?
Can you hear me now?
I can hear you, yeah.
Now,
He was. Okay, he was talking about when I go out in the open air,
mhm.
when I go outside, and I'm walking, looking at the trees near my home, in that area, breathing the nice air, the breeze. Should I use the mask still? I use it, or I usually keep it like in my pocket, just in case, and I just go walking. and just breathing the nice air outside. But when people come near me, then I put it on.
Yes, you definitely want to put it on when people are near you. But like I said, most places are recommending you do wear the mask when you're out, outside or out in public to protect yourself and others. And I forgot to mention also, now that the mayor has mandated that you have to wear a mask, they also said that if the first offense, you can get a $500 fine. The second offense is $1,000. They also have doing it for businesses because again, they're trying to, get it down to peak again. It's like up here, and they wanted to go back down here. And they feel if you wear a mask, everyone wears a mask. Everyone does, the social distancing and hand sanitizing and keeping themselves clean. Also keeping your hygiene up. Hopefully soon it should see that where it's up here, it should go down here, and the curve should be flattened.
Jane, I just helped Amber with her computer.
Mm-hmm.
I'm probably fine not to wear hand sanitizer, or should I put it on?
You probably want to put it on. However, I want to let you guys know one thing.
Put it on.
Yes.
Because I just touched the surface.
Correct. Now, you might want to look on the news. They did have certain hand sanitizers have been recalled because there is methanol in them, a type of alcohol. They said this right here. These I don't think would hurt, but certain hand sanitizers they said they found are toxic. So they recalled a lot of them. So you might want to check what kind of hand sanitizer you have and see if that's one of them that has been recalled. If it is, you might want to return it because they say it's not safe to use.
What if I had a hand sanitizer that smells really, really good from Bath and Body Works, and it doesn't kill like a lot of germs, but it smells really good? Is that fine? Or do I want to get the kind that kills 99% of germs? That doesn't smell maybe that great.
What do you think, Bill?
Bill, do you know?
Well, I have two thoughts on hand sanitizer. One is, of course, go with stuff that'll kill as much as possible. But more importantly, although hand sanitizer is useful, it is not as useful as washing your hands. Washing your hands is much better than hand sanitizer.
I have to wash my hands too.
Yeah, we want to do both. We normally think because of the alcohol in hand sanitizer that kills a lot of germs, and that is true. But we also know from previous discussions on this very show that the coronavirus is surrounded by a thick layer of fat, and it's very difficult for alcohol to break down fat. Destroys fat really well. So it'll rip away that layer of fat, and then anything can kill a virus if it's not covered in fat. No problems. So wash your hands as much as possible. One of the other issues with hand sanitizer, and comes back to the Bath and Body Works question that Audrey had. When you're washing your hands all day and you're spreading alcohol-based sanitizer on your hands all day, over and over again, your hands are going to get very dry. You're also going to want a moisturizer for your hands. That is not just because it'll feel better, but if your skin gets too dry on your hands, that skin will start to crack. And once your skin cracks and you start able to get blood out, basically, there's an opening into your body, and the virus can get in that way. So you want to make sure, wash your hands, sanitize when you cannot wash, and make sure you stay moisturized. And I believe that Gila has a question. Or just something to say, who knows?
Okay, so how was it on a map? With no map. With no what a map with no. How a map with no. So how was it with that?
Okay.
Your mask is slipping down?
Yeah.
Oh,
Okay, what I have here on the mask that I have a red mask and I have this one here. The good thing about, and this black mask that I have, which I had the same problem. This has a little round shape where I can take, if I want the mask to be bigger, I can make it bigger, expand it. If I want to make it smaller, I just do, take this part and I can make it smaller so my mask will stay on.
So you can
It's,
tighten them.
you can tighten it, so adjust it.
So how is it on a map? So like, not a map.
you've got a few options here, Gila.
Yeah,
So on these kind of masks, because you wear glasses, when you put them on, if
Mhm.
your glasses on top, they can help hold that in place.
right.
I don't do that very well, and I don't know that yours would do that very well. People with metal frame glasses would work a lot better than the plastic for that. Also, a number of masks, usually not the homemade ones, have a flexible plastic or metal thing up here on the bridge of the nose. Help squeeze
Right.
there, and that'll help it keep in place. It also helps with glasses to keep the fog out.
No, I don't look at one.
Types of masks rather than these basically flat one. It might work. And again, when you do this, you want to make certain that you cannot blow out a candle or a lighter through
Right.
a bandana. You will need at least to fold it twice. Like that. Or, and I do not have mine here, and I'm going to see if I can do it. What do you call those paper towels? I have a chamois that I use, which is reasonably thick and it wraps a couple of times. I would make a big triangle and then it goes over the head, around here, and you tie. This is really difficult with paper towels. And then once that comes out, I can just leave it hanging or throw it over here while I'm on my own. But as soon as I get out around other people, I take the long end of my chamois, which is a giant bandana, basically.
Then you make yourself a mask.
And then I can wrap it around, cover my mouth and nose, and then it comes back around here and tucks back in, which doesn't work with the paper towels. And then I've got that protection. It is also good for protection against sandstorms and sun in the desert, which is what it's originally for. So that will just stay in place because you're tying it quite tight in place. But you would need a reasonably thick one or to fold it multiple times to make sure that nothing's getting out through that. That will also keep it from slipping off your nose. Some of us have very small noses. Some of us have quite large noses. Those of us with large noses are in better shape for this, basically. I do not have it with me, have a mask that instead of clamping around the ears like this, it comes way up and straps onto the top of my head and then holds itself up there. So I don't have a problem with that slipping down at all. Woodworking masks often have that. So if you go to a hardware store, you might be able to find one there that's like that. Anything that straps way up. And that is different than some people, and I do, of course, have so you don't strap them on your ears, you get another strap. So if you're wearing it all day, it just holds on. That would not help with keeping it up on the nose. You want something that goes up instead of behind.
So what Phil is saying is there's different styles of masks that you can get. Different types, different styles, different colors. And
I
And then,
also have my emergency wearing mask in the car. Jane, if you continue for a bit, I will go grab that to show everybody.
okay, and also what you want to do is like my hands, I used to have, how some people have eczema and you have to keep your hands. There is like certain, if you do have that or you're allergic to certain type of soaps, there are soaps that you can get, those of you that might have certain skin conditions, for eczema or eczema or whatever you have, psoriasis, you can use, and they will help your hands out a lot. They'll keep them from breaking out, because what happened to me was, I didn't know it. My hands were so dry, like Phil mentioned, they started cracking and they started bleeding and they were infected. So I had to get a special kind of lotion to help them heal. So there are lotions out there like that will help you, like you mentioned, and it'll keep your hands moist too. So you don't have to worry about any cracking or worrying about the virus getting in or anything.
That's a really good suggestion that Jane had, because everybody has different skin. And if you're not really sure, guys, it's always safe and good to talk to your doctor. If you're washing your hands a lot and using sanitizer and they're a little dry and you're really not sure because you have a skin condition, what you can put on them, you can talk to your doctor about it and they'll let you know about what kind of lotions and stuff are good for your skin.
Very
Feels a
Oh no, the penguin's
Also-
back. Hi, penguin.
It's a crow. So if you have a problem with it slipping off your nose, you can just get a full face mask, just like this one.
I don't know, it looks like a penguin.
Bill, where'd you get that mask at?
Amazon, of course.
Oh my
Because
goodness.
it's me, I also have military gas masks that cover full face and have a activated charcoal canister, which would also keep it from slipping down your nose and is really excessive for coronavirus. For other things, like if there was a gas attack or something, that would be great. But you could use it for coronavirus. It would totally work.
It's a little scary though. Does anybody else think Bill's mask is scary? Amber, you think it's scary? Am I the only one? Me and Amber? I think it looks scary. If you're walking in the store and somebody looks like has that giant beak, isn't that kind of scary?
These are hurtful words.
Which I actually saw. Speaking of which, what Phil was talking about, I saw one lady in the store. I was in Walmart. She had a headset on her head and on her eyes. You know how you see a lot of the first responders, like the nurses and doctors wear. I don't know where she got it at, but I imagine if you could probably go online and see if you can find those. Also, another thing you want to make sure is with this virus, you don't want to touch your eyes, you don't want to touch your nose or your mouth, because that also you can also get the virus that way. Because a lot of people have gotten the virus in their eyes, and a lot of people have gotten the virus, with their nose by touching even their face, basically. And they said if you have any kind of like breakout or anything, like a rash, you might want to have it checked out, because there are different symptoms for the coronavirus. If you have a fever, if you can't, because it's a respiratory, a lot of people have trouble breathing. A lot of people exhibit, pain in their chest. Those are some of the symptoms, and exhaustion. So if you have any of those, you want to let your family or whoever your guardian is and check with your doctor. Those are just some symptoms that you want to keep an eye on as far as the virus goes. Do you want to add anything else, Phil?
Not on not touching your face. That is perfectly good.
Yeah.
But I am just grabbing. Yeah. I had to grab a picture. I want to show everybody something. Some people may think those kind of masks are scary, but we can see that you can definitely accessorize with these. And what's really handy with the young lady here is this wonderful framework skirt that she has. Will keep people feet away because you can't get close to her or you bump into her skirt.
Oh, I'm good.
Looks awesome.
Yeah.
All right, pray continue, Jane.
Okay, the next thing I want to mention, you see amongst what we used to do when I used to do janitorial services, this is a spray disinfectant. What it does is it kills most of your germs. It eliminates odors, and it also helps with mold and mildew. We would use this to make sure all the doors are sanitized. As was mentioned, any area that you guys would touch or we would touch, we made sure that all those areas were sterilized by using a spray disinfectant. This all can help stop the spread of the virus. So you want to make sure that your areas are clean, like the places you live, your home. You want to make sure they're clean, and you use this type of spray because it also will help prevent you from getting sick, and also cuts down your risk of getting the virus. So it's very important that you make any areas you touch, like this area. Say I touch this area here, I would need to take this spray and I would spray this area, make sure it's completely wiped down, and now it's sterilized. So there's no risk of germs or any bacteria. So this is another way of help preventing the virus or cutting down the virus from your home. So you want to make sure that your home is clean and it is sanitary. This also will help keep the spread or the chance of you getting sick or anyone coming in your home getting sick. So did you want to add anything?
Yeah, I would say that a spray like that, not everywhere, but you can take that out with you to some place you're going, some public place, and disinfect a thing before you get there. People might look at you odd if you go, or oddly, sorry, it's an adverb, go into a restaurant and you disinfect the table before you sit down. Let them look at you oddly. You're going to be safe. That will help keep you safe. Many of the things we do for coronavirus protection are about keeping everybody else safe, right? Particularly the masks. And that is one of the biggest things that we are learning about this. Normally, what we talk about with diseases and infections is how to keep me safe. And that is a very important thing with the coronavirus. But more important in coronavirus is we need to take care of each other. What we do is keep everybody safe. That what I do keeps you safe. What you do keeps other people safe. And that is the only way we're going to get through this thing, particularly masks. That's what it's about. Jane was talking at the beginning about people have quit wearing masks, even as the incidents have increased of coronavirus. That's a big problem because that's us passing it around to each other. That's why the numbers keep rising, is because we're not taking enough care of one another. It is the most important thing we can learn, apart from washing your hands, from coronavirus.
The other thing is, if you go into the stores, you will see that they have a special chemical that they use to clean the grocery carts. So when I go in the store, I ask them, is this grocery cart been sanitized? In other words, has it been cleaned and disinfected? Because if not, like we said, you touch that. Also, that's another way you can get germs. And if somebody else has touched it, you can also get germs or bacteria from another individual. And if that person has the virus, you may well pick that up. So that's why a lot of places are sanitizing their grocery carts. They're taking breaks not only to restock, but also to clean their areas. And then when I went to Walmart and got my hair done, before he did my hair, he sanitized his entire workspace, not only to protect me, but also to protect my stylist. And then once he's done, he re-sanitized the area. And a lot of the stores I went in, I found like City Trend, a lot of places have hand sanitizers. They have masks. They have stations when you go in, you sanitize your hands. When you leave, you hand sanitize your hands. And a lot of places do provide masks. Like I said, they do provide the hand sanitizers, and they recommend you wear a mask. I was in Half Price Books. He thanked everybody for wearing masks. He advised a lot of people to wear masks. So, a lot of places do have these masks that you go in. They have the hand sanitizer. And they're grateful that because you're not only protecting yourself and others, you're also protecting the businesses and the people that work there. So I've seen a lot of places that have done that, and I think it's great.
So when Jane's talking about, if you're not sure that a shopping cart or one of the little basket things, a lot of places aren't using those right now, but those that are, if you're not sure that they've been sanitized by the staff, the disinfectant spray that Jane was showing us earlier, or the sanitizing wipes that you got in her package, those are good for that. Just whip out a wipe over the surface that you're not positive about and go out. Remember, there are other options for a lot of these things. Jane was talking about her barber was sanitizing everything, or stylist. I don't remember if you said barber or stylist, and I don't know what you use, but really irrelevant. Both of them ought to be sanitizing. So that is one option. Make sure you're going to a place where if they're cutting your hair or whatever sort of hygiene thing you're doing, I guess you could get your nails done, but it seems like a bad time to get your nails done. But some people need it. Make sure they're sanitizing. I, on the other hand, just cut my own hair, and I'm not going to pass any diseases to myself because whatever I've got, I've already got it. Caitlin, you got a question?
I'm getting a haircut this Thursday.
Well, make sure that it's well sanitized when you get there, and sanitize yourself, because
I will.
it's not just about the person cutting your hair not giving you something, or the person who was in the chair not giving you something. It's about you not passing it to them. We want to make sure that we're clean and we've got our mask on and we're not passing any germs to anybody else.
And make sure that the equipment they are using to cut your hair has been sterilized and has been cleaned.
I don't know about everybody else, but when I used to go to a barber before I started cutting my own hair, because I'm that sort of crazy, they got those jars of blue gunk, a sanitizer. That is a disinfectant. If they're sitting in there, everything's going to be dead coming out of there.
Right, and they make sure their areas are clean too. Like if there's any, like Caitlin's getting her hair cut. If there's any hair around their area where she's sitting where they've just cut their hair, we're going to go ahead before they cut anybody else. So I noticed they go ahead, they clean their station, they clean their equipment, and they also make sure if there's any hair on the floor, that hair has been removed and put in the trash. So now that whole area is clean and sanitary.
One of the other things we want to make sure about when we go out and do things, because we're doing this more and more now, and as we're slowly reopening PALS, people in the facility or people in step groups. I don't see anybody in a step group logging in right now. When you get home, you want to make sure that you change your clothes. And at least when you take them off, the best idea would be to get in the shower, totally clean yourself, and then put on fresh clothes, put the ones you wore while you were out directly into the laundry. At a minimum, change your clothes, get those directly in the laundry, and wash your hands. Wash your hands, wash your hands, wash your hands. Always wash your hands.
Because that's what I did. And that's one of the things that I was talking to Mardessa about was, when you get home, Jane, I take a shower in the morning. When I get home, I take another shower. I put my clothes in the washer, make sure they're clean, and I put clean clothes on because it's really important. Hygiene is the most important thing you can. The more you do that, if you continue to do that, you protect yourself from the virus and you kill the bacteria, you kill the germs. So that makes it less easier that you don't get sick, or if you're around somebody and they're not, you protect yourself basically. Because like they said on TV, do what you normally do. Get up in the morning, take your shower, go through your routine. And then every time, and another thing I found out is when like Phil talked about restaurants, one of the things you want to do if you go to the restaurant, if you go to the store and you come home, wash your hands. It is very important because of stuff that you don't know if that person has a virus or not. And you see people picking up vegetables and fruits, wash your hands. And you might also want to wash the fruits and vegetables or, the whatever you purchase.
Oh, if we destroy COVID in the next however long, if it is gone like smallpox is gone, still wash your fruits and vegetables.
Right. And your meats also. They say
Caitlin, do you have something?
Yeah, yesterday I went on my step program. I came home. I washed my hands when I came home.
Excellent idea. Did you change your clothes?
Yes, I did.
Good job. When I get home, the first thing I do is take off the usually suit that I'm wearing, and I put on my nightgown and my slippers and my robe, and then I sit quietly. So I'm definitely clean and change my clothes.
Oh, and also make sure you wash your hair too, because they said you can get it in your hair. Another thing you want to make sure of, they recommend you clean your shoes because they said now they found out you can also get the virus in your shoes. So it's very important you make sure your shoes are clean as well.
All right, I think that just about wraps up our time here today. Yeah, I saw Jose has another question, but we're out of time. Sorry.
Okay, so
we'll kick it over to our producer and continuity.
Thanks, Phil. So, and thank you, Jane, for all the informative tips. That was really helpful. It's great to see everyone's perspectives, and we're all such a big family and team that when all of us are learning about stuff, sharing it together is a great strategy. So. So I am going to allow you guys to unmute yourselves and socialize while we set up for our last segment. We'll see you guys soon.
Take care, everybody.